Do you want to instantly lower blood pressure? Today learn what, when, where, who, what, why. Every day. And it works. Before we continue, stay up to date. Join Health Instincts. Tune into your instincts by putting on post notifications so you won't miss a single vid. Hey. It also works because the benefits are felt instantly, and it's super easy and convenient. Most people have pre-high blood pressure. Sadly, about 75% of people don't even know they have high blood pressure, and thus are at risk for a heart attack, stroke. Hypertension is a silent killer because people, they aren't aware of it. There's no clear symptoms. Even if you think you don't have a high blood pressure, you can lower your stress hormones using today's, and for the rest of your life, acupressure. So you can go into our description and look at some of our other amazing videos for reducing inflammation, lowering blood pressure. Pressure point number 1 to lower your blood pressure. They call this L4, large intestine. It's in that meaty part of your upper hand between your thumb and forefinger. Just use your other hand's thumb to apply pressure for 1 to 2 minutes, or treat it with a pulsating movement. It treats chronic pain and it boosts the immune system. Pressure point number 2 is PC6, pericardium 6, or inner gate. To find it, go approximately 3 fingers up from your wrist. It helps your heart and it settles your blood pressure by regulating your circulatory system. It can also treat nausea, headaches, and motion sickness. Pressure point number 3 is LV3. This helps with blood pressure in addition to menstrual pain and anxiety. When massaged, it can bring great improvement to your health. Just roll a ball under your foot every day. Your feet are correlated with your whole entire body. Pressure point number 4 is gallbladder 20, or the wind pool. This is found at the base of your neck, right under your skull. There are 2 points actually on each side of your vertebrae.
Now, as a result of this muscle over-contracting, this is leading to a lot of severe symptoms like neck pain and headaches and migraines, visual disturbances, ringing in the ears, vertigo, pain in the neck, along with decreased range of motion. The list actually goes on and on. But the problem with this condition, it's not picked up on MRI, X-ray, or CAT scan, so when you see your doctor, they're never finding this particular cause. So behind the skull, there are 8 suboccipital muscles, 4 on each side. So many of you may move your head a certain way and you notice you get this vertigo or this dizziness or this giddiness. That's most likely coming from the suboccipital region. The most important thing is the muscle fascia, the strands that come off the suboccipital region attach to the outside of the spinal cord, the dura mater. And that's what's called the myodural bridges. So let's analyze this again. You have contracture, the suboccipital region, attaching to the outside, the dura mater of the spinal cord and brain. As it contracts and pulls from the contraction, the shortening, or the spasming, we're going to get significant neurological changes throughout our system. It's time to get to the real test. I challenge every one of you, please follow me. Take your hands, wrap it around behind your skull like this. Take your thumbs, put it right underneath the skull. You got to dig deep, and I want you to hold it there. Watch my eyes. You're going to move your eyes side to side, left and right, left and right. You can close it and do it, or leave it open. Then go up and down, up and down, up and down, left and right, up and down. Feel those muscles move. Those muscles are moving from the eyes that are moving up in front. You can see the connection behind your skull and come back up. Good. Okay, stay in that position. Now we're going to do it again, but when we do it again, we're going to look down when we stretch our chin all the way down to our chest. And we're going to look up when we bring our head all the way up. Let's go. As you bring your chin down, stretch it, look down, 3 seconds. 1, 2, 3, come all the way up, look up. Okay, come back down. 3.
Learn 4 de-stressing points you can do with a partner or yourself if you get a certain tool. There'll be a summary, and I'll put the points in a collage just for you.
Her skull. And the most important thing is not to mess up your hair. Yeah. Okay, so we're going to, there's this little ridge right underneath the skull. You're going to slip right underneath it, and you're going to press in equally, okay? And you're going to take your hand and press in the forehead. So you're going to press in right like this. You feel that? And the key is to make sure that you're equal, like called the clavicle. And you have these little muscles underneath here. No one ever works on these muscles, ever. And it's a source of a lot of tension, especially if you're sitting all day and your posture's bad. But what we want to do is we want to hook the finger up underneath these 2 bones and have her lift her head back. All the way back, all the way back, 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 back. Stretch it back. And I'm lifting up on the collarbone, okay? And so I'm spreading my hands out and then inward like this. Okay, go back. Good, go forward. Go back. Good, forward. Go back. And I'm lifting up as I'm pressing in, okay? And what will happen is she'll be able to tilt her neck all the way back after doing that. In fact, next point through here, second one, and I have basically in the mid-back, you have something called the sympathetic nervous system. Okay, that's the flight or fight. That's the stress part of the activation of the nervous system that helps you counter stress. It's from the top of the upper back to kind of almost to the lower part. Okay, and there's this ligament on the front part of the vertebra on the inside that's really tight with a lot of people. So we're going to stretch that out. So when we're done, not only is she going to be, you know, very good posture, but she's going to feel very relaxed, okay? So we're going to take your first finger and your thumb like this, okay? See that? Okay, see that right there? And then we're going to take this, and I like to grab the shoulder, but make sure you don't like press down here too because it might be sore, but go ahead and tilt your head back because it might be sore, but go ahead and tilt your head back. Now, go forward. Good. And back. And I'm pressing and I'm holding her body over this pivot point, and I'm keeping this part straight, and my elbow is tucked into my body. So I'm not like this, because I'm like, if I did like this, tilt your head back, be like, oh, this is like a lot of work, right? I'm gonna keep my body directly behind her, put this right in the center, and have her do the work. Stretch over this point. It's kind of like a leverage point. Good, come back. This one, it feels really good. It's important. It's a little hard to do if someone's really big, but just have them do it. Stretch. Lay back down on my bed. We're gonna do, these points are a problem for everyone. The adrenal glands are deep, very deep on top of the kidney, deep in the abdomen, okay? So there's no way we can contact the adrenals. However, there's a lot of acupressure points around this. There's a lot of nerve points around the adrenals in this area. And in Chinese medicine, there's acupressure points that go right along the side. We're going to be kind of tapping into that and releasing a lot of the stress in this area around the adrenals. So her belly button is right here, okay? So we're going to just go right to the right of it, her right, and down about 1 inch. And we're going to press down in here. Now, I'm showing you how to do it on someone else, but we're going to show you how to do it on yourself. So I like to take my thumb and my middle finger again. I'm not flipping you on. And I'm going to press down in here to her tolerance. And I'm actually trying to find some tenderness. This isn't too bad. So if I don't feel any tenderness, I'm going to kind of sneak up a little bit. And I'm going to do all these points up on this line about 1 inch off the midline. Okay, so we're going to come in here, press in here, and I'm going to go to the left and to the right a little bit just to kind of find these stress pockets. Okay, let's see if I can find these. Yeah, she has a couple right here. And then once I find it, I'll just hold it for a little bit. Up underneath the clavicle, and your points right through in here. Opposite side. and press on that. Now, if the person has low back pain, what you do is you press on the exact opposite side on the front. Bam, gone. So you want to find out where it's hurt. Hook it on the back of my neck, scoot this down on a tall back chair or the couch. I think this works better than using it on your pillow when you're going to sleep at night, because you're at a certain angle and you can sit back and just let these points press right into your neck. And there's a sweet spot that you want to hit that you'll just feel like the maximum release of stress, and you'll just want to take a nap. I fell asleep. Sometimes I'll do this on my desk. I'll put my feet up and I'll sit back and I will just like go right out. This is like the most important acupressure point for your entire spine to feel relaxed and to melt. Then you do that for a little while, and then you come down to the next point through here, second one, and history of a lot of neck problems, so I do this a lot to keep my neck nice and relaxed. Okay, then I'll inch down to the middle part, like C5, and this is again really good for tension in your upper shoulders, and also good for your, believe it or not, it's going to help your voice. Yeah, hoarseness. Because underneath my body, okay, I'm laying in bed with my pillow, right? I put this in the lower part of my spine. So my spine, the middle of my spine is right here, and I'm laying down. So I'll lay on these 2 points. And what's cool is that the mattress is soft enough where it squishes in, so it doesn't because if I did it on that table that I worked on those other people with, it would be too invasive. So on your mattress, it's better because you can lay back on it. So I take it, I put it in my back, and I guess the camera person can see that. Can you see that okay? And I lean back like this. And so the cushion takes most of the slack, and I'll just lay there until the points where I'm like, oh my gosh, that feels so good. I inch it up, and I lay back down on my bed. So I'm like to the left and right side of my spine, I'm gonna hit every single vertebra going up. So it's kind of like a wonderful massage. Okay, but with the muscles, you're working on something called the autonomic nervous system back there, and it tends to relax the whole front part as well. So I'll do that point, kind of let it slip down right here, and I can let it slip down and just do this right here. So that way you get your mid back, okay? You can do your neck, do up underneath the clavicle, and your points right through in here.
Pressure point 5 is GV20, governing vessel 20. This is found at the top of your head, in the middle. You can massage or press this point to lower blood pressure, treat dizziness, or just feel more rested. Throughout the day, if you implement all these pressure points, you will see results, like crowning.
Forehead, around the eyes, and will often relieve a tension headache just by doing this little exercise I'm going to show you. It's called the crown pull. And so let's go ahead and just take the fingers to the front of our face, or front of our forehead, thumbs resting on the temples. Relax your shoulders, push your fingers in, and then while we're pressing, just drag the fingers out. We're just like pulling the skin apart there and shake it off. Bring the fingers up a little higher onto the forehead, press the fingers in and dragging our fingers out towards our thumbs and towards our ears. And shake it out. So we're going to follow that center suture on our spine all the way to the back of the head, that same motion. So the fingers, the center, pressing in, just drag it towards the ears. And then back a little bit further, pressing in, dragging the fingers towards the ears.
Acupressure is great, but if you have an investment, if you want to invest in yourself, not in paying $100 for shoes, when you could have spent that on so much books that will actually help your life. Point being, get blood pressure optimizer. It's proven, it really does work. In the description below.